So I have a patient coming in today. Her name is Lacey, and she sent me some pictures, and she looks to have some pretty bad calluses on her feet. So essentially, calluses can serve as a source of protection on the bottom of your foot. However, sometimes the callus can actually be harmful to you. Sometimes people have a condition called metatarsalgia, and essentially what that means is that the metatarsal bone in the foot, instead of being straight, it's tilted. The tilt provides a little bit extra pressure, and so the callus forms right underneath it, which essentially provides a lot of pain in that specific area. So I'm anxious to see Lacey's feet to figure out what's going on and to see how best I can treat her.
I'm so desperate to find relief. My feet hold me back a lot. I've got 6 kids ranging from 13 down to 4. I can hardly walk, and so it really affects my entire life.
Hello.
Hi.
Are you Lacey?
Yes, I am.
Nice to meet you,
Nice
Dr.
to meet you.
Vincent. How are you doing?
I'm ready for my feet to feel better, that it hurts, and I'm
How long have
over
your
it.
feet been causing you pain?
About 13 years, I guess.
Like was there an injury, or why have they been hurting for so long?
I just sat down one day and my foot hurt, and I looked at the bottom of it, and there was a callus on it. And well, from then until now there's 4.
So it's just getting worse and worse.
It's getting way worse.
Have you tried anything to help it?
Cutting them off, sanding them off, remedy like duct tape every night.
Ooh.
And none of it takes them away.
I've never used duct tape for calluses.
Did not do anything
It didn't
at all.
do anything?
No.
Well, let's see how bad the damage is.
Okay.
This is a really extreme case. Lacey's calluses are just so big, it probably does feel like she's walking around with little marbles inside of her feet. That would be excruciating pain every single day. So essentially you have what's called metatarsalgia, and that just means that the heads of the metatarsal is protruding so far on the bottom of your feet. Calluses are there because this is where you're putting the most pressure when you're bearing weight. You don't have enough cushion on the bottom of your foot in order to have that shock absorption.
Okay.
The first option is a debridement. Shaving down the calluses is just temporary, a temporary
yes.
solution.
Yeah.
So the one option that's most definitive to fix the bone would be a surgical option. Probably be the best solution for long term.
My anxiety is like through the roof, and I'm just scared. There's no way I can
There's
do
no way
that.
that you're like, that's not gonna happen.
Not gonna happen, no.
So Lacey definitely needs to do something about this now. Her calluses are gonna get bigger. The potential for her getting open wounds to the bottom of her feet are gonna be really increased. And then she's open to infection, and then it's all downhill from there. The other thing that I've been offering to patients is fat injections. I know. It's
what woman wants that?
I know. Who wants the fat to be put in there? But it's different because it's on the ball of your foot.
Yeah.
So it acts as more of a cushion on the bottom of your foot, which can actually help prevent the callus from formulating.
Okay.
The fat injection we can actually do today.
Oh, gosh.
It's completely up to you.
Oh,
I can see you're
making
super
me
uncomfortable.
So panicking
I'm like,
right now. I know. I'm sorry.
I know. It's okay.
Like, I've had 6 children, but I am literally...
You've had 6 kids, and you're afraid of a little needle?
But, like, babies are my thing, but
not
anything
needles,
else makes
nothing
me
else.
so crazy
Like, you're like,
scared.
No. So what options would you like to do today?
The debriefing's fine, and, oh, gosh, I'm sick of stabbing myself with a scalpel. I'm sick of it. I just want it to be over with.
I hear ya.
I'm so desperate to find relief that I'm willing to do whatever it takes, even if that means getting over the fear of the needle. We can try the putting fat in my feet.
Are you sure?
Whose fat is it?
It's hard. I know. Whose fat is it? I mean, sometimes you're like, can you just take
it
a
off
little
of
bit?
me? Oh, gosh.
Can you take a little bit? No, it's harvested. And then it's curated and...
Okay.
So the fat that I'm injecting into Lacey does not belong to Lacey. It is from a deceased donor. So we are appreciative of their life and donation and their fat. The way that the fat works, the injected fat stimulates your own fat cells to populate.
Oh, okay.
So that will happen over the course of 12 weeks.
And it won't travel. It'll stay in my feet.
It'll stay right in that pocket. You'll kind of know, like you'll see
something bulking up down there.
It'll be bulgy.
Now, how many of those will I need?
Theoretically, people do it once a year for 3 years, and then they shouldn't have to do it afterwards.
Okay, well.
We should probably only do it on one foot. You need to have 1 foot to stand on, because I do require people, if they do the injection, to be off of their foot for about a week and a half to 2 weeks.
Okay, so this is the one it started on, so I think we should probably start with that one.
So do the right foot.
Yeah.
Okay. So Lacey is on board with my plan today. However, she already warned me that she's a big baby. Most people are big babies when it comes to needles in their feet. So am I.
Okay.
Deep breath.
Okay.
So the plan for Lacey today is to debride her calluses as best as I can, and then to inject some harvested fat into the balls of her foot. I'll do this guy first. Just let me know if you're in pain. So when I do shave calluses, I try to be as careful as I can so the patient's not in pain. But I also want to get deep and deep and deep enough so that way the patient doesn't get more buildup of the callus in a shorter period of time. Okay, we're done with this foot, so we're gonna move on to the one we're gonna give you the injection in, okay?
Okay.
Just kind of relax as best you can, I know. Don't forget to breathe. This is the easy part. Lacey's calluses are kind of like icebergs. There's definitely something going on at the surface level, but once you get deeper and deeper, you can see just how much damage there truly is. Her calluses are incredibly thick because there's not enough cushion in between her bones and the ground in order to have any shock absorption.
That one was way easier.
That one's way easier. All right.
Okay.
So after I'm done debriding the calluses, the next step is to inject the fat injection. To prepare Lacey for the fat injection, I numb her up with lidocaine. Your objective is to not, like, flinch.
Oh, God, okay.
You just kind of have to bear down and, like, you ready?
I'm having a meltdown.
Here we go. 1, 2, 3. Try not to move. I know.
Ow!
I know. Try and relax, relax. Very good. Almost done.
Oh, please.
Done.
With what? The numbing or the?
Yes.
Oh my God, we haven't even done the fat yet. This is
But
bad.
that's good. You won't feel much
Oh my
at
God,
all
that hurt.
afterwards, okay? Relax. Think of happy thoughts right now. Are you still in pain?
No, I'm just
You're
having
just
an
nervous.
anxiety
You just,
attack.
like, breathe it out. All right. So now that Lacey's area is all numbed up, the next step is to actually inject the fat injection. So basically, I have to use a larger needle that goes in to the ball of the foot because the fat I need to use a larger needle. Okay, you ready?
No.
Try not to move. Pressure. Pressure's okay. Relax. If she doesn't stay still, I could potentially inject the fat into the wrong area. In worst case scenario, she could actually make me break the needle. Good, that's it.
Okay, good. Thank you.
Relax.
Wasn't that bad?
No, it wasn't that bad. I'm gonna put these steri strips, okay?
Okay.
This is gonna keep the fat where I put it.
Ugh.
It's okay, and like I said, no weight bearing for at least 2 weeks. I'm gonna get you some crutches.
Okay.
This should plump up
Okay.
over a while, okay?
So don't like freak out when it's
Don't freak out.
When my
Feels like-
toes feel like they got fatter underneath already.
They did. They're
Okay.
you know, blowing up in size. Okay.
Okay.
That's it.
Okay.
So everything went great. I got rid of Lacey's calluses on both of her feet. I was able to inject the fat. Over time, I feel that fat pad layer in the right foot will increase.
You can already tell how much better it's gonna feel.
Gonna feel after I've messed with you today.
Yeah.
All right.
Great, thank you.
You're welcome.